welcome to Menopause Rescue. I'm Dr. Polly Watson. Midlife women are often caught up in a sea of symptoms. Too often, they're overwhelmed by the lack of support from mainstream healthcare. They're inundated with so-called experts who are selling solutions which may lack credibility. I'm a Menopause Society certified gynecologist with both traditional and functional medicine training. I'm here to guide you through this transition and help you decipher the facts from the fads. Armed with credible information, I hope you are empowered to rescue and restore your health, making the second half of your life your best. Welcome to Menopause Rescue. I'm your host, Dr. Polly Watson. This is part 3 of a 3-part series with Kate Willis. Kate is a very important part of our team at Hormone Wellness MD. Kate has over 16 years of experience in both functional and traditional medicine, and 5 of those years were spent in dermatology. Today, we're going to be focusing on 2 things. The first thing is rosacea, which is a super common problem, and many women get red in the face about being red in the face. So Kate's got some really great, thoughtful combination options to treat rosacea. A little bonus add-on to the end of this episode is going to be talking about using topicals for hair loss. So if you haven't already listened to Kate and I's first episode on hair loss, go ahead and start there. Here, we're going to not dive into the specifics of different kinds of hair loss. Please listen to our initial episode on hair loss to learn the basics. In this little bonus on hair loss, we're going to be talking about different agents and how they work on different types of hair loss and how we can combine them to get the best results for you. Thanks so much for listening. If you enjoy these episodes, please share them with your friends and family. Welcome to Menopause Rescue. I'm your host, Dr. Polly Watson. Today, I'm so excited to be joined again by Kate Willis, nurse practitioner. Kate and I are going to dive into 2 areas that cause a lot of frustration for women. One of them is rosacea, that kind of redness and inflamed skin. Sometimes it's associated with kind of pustules. Sometimes it's associated with little thin blood vessels on the face. And we're going to revisit and retouch on some compounded options for hair loss because we're seeing a lot of options direct to consumer online. And we just wanted to kind of go through and help people understand why you might want to blend certain products. So I'm excited to dive in. Kate, welcome back. Thanks so much for being here. So we're just going to kick it off and dive right into rosacea. Tell us a little bit, what exactly is rosacea and how does it present? And Kate, I know this is a really frustrating area for a lot of patients. It can be kind of complex to treat rosacea. Why is this kind of a challenging condition?
Rosacea is frustrating, and we see it emerge sometimes or worsen during midlife. It is a chronic inflammatory condition, and it affects mostly adults between age 30 and 60, and it affects around 16 million Americans. So it's a pretty common phenomenon. There are multiple components to rosacea. So this involves facial redness, flushing, visible blood vessels. So if you've ever seen someone with blood vessels on their nose or cheeks, bumps or pustules that can look like pimples, but they're usually distributed kind of in the cheek or on the nose. This is rosacea. So multiple different ways that it can manifest. Part of the challenge is that it is multifactorial, not just in the way it presents, but in the etiology of what causes rosacea. This is involving the skin barrier, it's involving the immune system, it's involving dysregulation of the neurovascular system, and there's even this connection with the gut and the skin microbiome. So this is a really extensive problem in terms of the number of systems that are involved. It's also really highly individualized. So the way we treat it in one person doesn't always work for someone else. And so we need to really personalize the approach. Also, food triggers some people and that, are not a trigger for others. So again, this is really a highly individualized treatment plan that we need to come up with for each patient.
So now we're going to dive into different treatment options for rosacea. And we've come a long way in this area. So a lot of us are probably familiar with metronidazole cream or Flagyl, which is the brand name for metronidazole. And we've maybe moved away from that a little bit. So I'd love it, Kate, if you could talk to us about a little bit more about, is metronidazole the best option and what some other choices might be? Comparing ivermectin versus metronidazole, can you kind of tell us, Kate, how those stack up?
Well, what's interesting is I see a lot of patients that get put on a metronidazole topically through their primary care doctor or even a dermatologist. And that's actually not the most effective thing to use for rosacea. And that's where a lot of patients are frustrated because they feel like I'm treating this and it's not going away, or it's gotten a little bit better. And I do think the cool thing about the work that we get to do is we are bringing in kind of the best of functional medicine, of exploring why people are having problems in the first place, but then also getting to pull in conventional treatments that work and that are effective. And so that's really fun. It's been around for a long time. It's an antibiotic, so you can take metronidazole orally. For rosacea, we're specifically talking here about using it topically, so it's anti-inflammatory and antimicrobial. It usually works slower than ivermectin, so that's why ivermectin is often winning head-to-head with metronidazole. It's probably a little less potent than ivermectin. It's great combined with ivermectin. And so that's one thing I would say is like combination. If you have really tricky rosacea that's not responding to one thing, combinations are great. So metronidazole certainly is not a bad product. It certainly is not worth throwing out. But it is, I would say, usually if someone has, rosacea that hasn't responded to a single agent, this is generally going to be best combined. Ivermectin, actually, which I know has had its kind of controversial day in the sun, but this is topical ivermectin. This is not oral ivermectin. It is a cream. The reason that it is effective and helpful for rosacea is that it's both anti-inflammatory and anti-parasitic. And so we think that there is a mite component for some people's rosacea, so these Demodex mites. And so that ivermectin is actually working to both calm the inflammation that is part of the rosacea picture, but also reducing the mite activity. And this isn't something that you can look at in the mirror and see if you have mites. But that is, I don't know that it's in everyone that has rosacea, and I don't think it's in everyone's skin, but it is, can be part of the rosacea picture for some. So this ivermectin topical was more effective than metronidazole in some large trials. And so it's a great thing to use. It can reduce those bumps, especially. So if someone has pustules, that's ivermectin is something that I want to reach for. There is a brand name called Soolantra. I'm not sure of cost of that currently for that product. But ivermectin's been around forever. And so it's something that we can put into a compounded topical as well to treat this. It's a once daily application, so it's a great option. Because it's anti-inflammatory, it tends to be more soothing to the skin and calming. I've not actually used Soolantra, so I don't know if that branded product is, particularly tolerable. But my understanding is that ivermectin is quite well tolerated, partially because it is anti-inflammatory and its activity as well.
Another option is azelaic acid. I'd love it if you could explain what azelaic acid is and when you would consider recommending that.
Yes. So this is also available by prescription. It comes as a gel. You can get it compounded into a cream. It is anti-inflammatory. It has some antibacterial components, and it helps also with that residual pigmentation that people will get sometimes from rosacea. So if they've had not just that flushing, but the redness that doesn't go away, this can help. There was one study that I found that showed that this cut those inflammatory lesions by 65% over 12 weeks. And we're generally using this one twice daily for the skin.
One of the other things that's fantastic when we're compounding is that we can put the different medicines in different bases. And so when we have the option to choose between like a gel or a cream, maybe you can help people understand why for certain skin conditions you might want to pick one over another.
So if someone has really oily skin, a gel might absorb really nicely. You know, a lot of our patients that we're treating have um, aging skin or drier skin overall. And so a gel probably would not be my top choice with those patients. Um, I like being able to put this, if someone would benefit from it, into a cream that might have a better feel and might be maybe friendlier to their skin overall. So depends kind of on what else is going on with someone's skin.
Niacinamide is kind of a big deal and a lot of just general anti-aging skincare. Does this have a role to play in rosacea?
So vitamin B3 or niacinamide topically is anti-inflammatory. It really is great for that skin barrier. So, a lot of times with rosacea, we get that kind of just irritated, kind of almost like broken down feeling skin on the areas that are affected. And this really can help with that redness, that irritation, and that skin sensitivity. So it is also helping hold water in. So it's not going to be a primary treatment like ivermectin or metronidazole for rosacea, but it's a great addition to a product or a regimen for rosacea for those reasons.
Just to clarify, how important is skin barrier function when we're thinking about rosacea?
Our skin barrier is extremely important, and that, the things that are good for a baby's skin are going to be good for someone's skin in their teen years and in midlife and beyond. And so there are, certain ingredients that we pull in for different skin conditions, of course. But really protecting that skin barrier, the skin barrier keeps moisture in, it keeps, damaging components from the environment out, it keeps infection out. And so I think prioritizing the skin barrier, whatever you're treating, whatever your skin concern is really important.
So far we've talked about a lot of kind of Western medicine, pharmaceutical options for rosacea, but we certainly know in functional medicine, the gut plays a big role here. So how can we use lifestyle medicine and nutrition and gut healing? How does that come to play when we're thinking about rosacea?
This is one condition that, I think is really responsive to the functional medicine approach. Whereas, you can be living the healthiest lifestyle and your skin may show lots of signs of aging. I think this is one place where lifestyle really shines. I mentioned the skin barrier, which is less of a lifestyle thing, but really being protective of that skin barrier. Glycerin-based cleansers are really great here because they're not stripping the natural oils of the skin. They're keeping some protective layer. And so, glycerin-based cleansers are great. Vanity cream, I mentioned in another episode, but they have a great gentle cleanser. Vanity cream is a company that makes products that are often used for compounding. Like if a child has eczema, you might use Vanity cream because it's so gentle on the skin. But there are plenty of other glycerin-based cleansers, and then using like niacinamide or creams with ceramides will really help with that skin barrier. Um, Nutrition is really important. So rosacea has a connection with inflammation and especially gut inflammation. And so we really want to be focusing on an anti-inflammatory diet. And I just say this is one that is rich in plants. This is one that has lots of veggies and lots of color. Um, my patients all know because I talk about her all the time, but Deanna Minich, I think is how you say her last name. She's a lecturer with the Institute for Functional Medicine. If you go to her website, deannaminich.com, I think is what it is, she has loads of free downloads that help you incorporate more color into your diet. She has a color wheel, she has a recipe book, she has a, variety tracker, and really her encouragement is to get as many colors into your diet as possible. Leafy greens, colorful cabbage, different, you know, types of apples, so that you're getting different phytonutrients. But she's really helpful there if you're looking for a free resource to be able to do that. SIBO, which is small intestinal bacterial overgrowth, is thought to be present in half of people who have rosacea. So, really thinking of what's going on in the gut. And this is, again, where I think functional medicine really shines, because we're almost always thinking about the gut as part of the overall picture of someone's health. But rosacea, when we see this is a flashing light that we need to consider the gut as a high priority. Often SIBO, this is where good bacteria moves up into the small intestine, or finds its home in the small intestine where we really don't want it to be. And so we can treat this with some oral antibiotics, some herbal antimicrobials, and we can use dietary support to help, improve the flora of the small intestine and improve the flora of the large intestine to hopefully keep this from coming back. So, diving into that's a longer conversation. But if you have rosacea, please think about your gut and think about what's going on in the gut, especially if you tried these topicals and they're just not moving the needle. You can use topicals all day long. And if your small intestinal bacterial environment is what's driving your rosacea, you may not see much of an improvement.
Can you talk to us a little bit about diet and what kinds of foods or nutrients might be helpful?
Alcohol is very high up there. I mean, we know alcohol disrupts the microbiome, but alcohol is a particular trigger for rosacea. So if someone's drinking, a glass of wine every night, I will have a conversation with them just about the relationship that might be having with their skin. Some people are really sensitive to spicy foods. And again, I think about, and this is a longer conversation, but some of the foods that might flare SIBO symptoms, if we're flaring symptoms in the small intestine, we're probably also flaring some inflammatory mediators as well when that happens. And so these can be, garlic and onion, things that are really great on many accounts, but in these conditions might be particularly triggering. I see a little less connection with dairy and rosacea. I see more kind of with dairy and acne. But all this might look a lot like acne. It's a little bit different in its etiology. But I think, if you're willing to do an elimination diet and eliminate some common triggers like gluten and dairy, and soy and corn and things, sugar, things like that it could be helpful to determine if you have a particular trigger.
So we're going to switch gears and talk a little bit about hair loss. Now, Kate and I have already done a podcast on hair loss. So if you kind of need hair loss 101, understanding the difference between, let's say, an autoimmune hair loss like alopecia areata versus telogen effluvium, which is sort of stress-related hair loss, versus male pattern balding, basic labs to get, check out that first podcast Kate and I did on hair loss. That's kind of your basics. This little bonus is going to be an add-on to some options we have for compounding different topicals and layering them to try to really get a better clinical outcome for people. So one of the things that is a deciding point is deciding about oral medicine versus topical medicine. And so, Kate, can you talk a little bit about when you would prefer a topical over an oral medication for hair loss?
Yes. So when we are trying to get follicles to grow hair and we give something systemically, we are not just selectively targeting these follicles on our head. We can also target other follicles like on our chin or on our abdomen or, other places we don't want excessive hair growth. And so in general, that and sort of the overall avoiding systemic side effects, it gets the ingredients where we want them, using things topically, and can be really quite effective. So we also see with some of these agents, we see some hormonal side effects as well, not just hair growth, but taking these or using these topically can help us avoid getting those systemic side effects.
The next thing we're going to talk about is minoxidil. I'll be really honest, I'm a little bit of afraid of minoxidil. One of the things I know about myself is that I do pretty good with supplements and I do pretty good with taking my skincare regimen and all of the things, but I also know that I'm not perfect. And when you stop minoxidil, you can often have a lot of hair shedding. And that's been a huge reason for me to sort of hesitate prescribing it. Some people do really well with minoxidil. Some people have a lot of dry scalp issues, other issues. Certainly, orally minoxidil can have some hair overgrowth issues in the other parts of the body. And so I think we want to be kind of mindful when we're thinking about minoxidil, about having a really honest conversation with the person on how religious, so to speak, they are going to be to using it regularly and that they're really going to commit to using it long term. Kate, can you explain a little bit on how that works?
Our hair does not grow that fast. And so to see the effects of something that we're using, topical or oral, you got to stick with it for a little while. And so that's why, I will talk kind of about minoxidil specifically right now, but I tell people, give this 6 months, give it 6 months. I'm a big fan of minoxidil. I've been using it myself for the past 8 months. And for those that are watching on video, I was getting some thinning here, and you can see this is all new growth. And I have a lot more too, but this is 8 months. This is 8 months of therapy. That's it, the bang. And so, you really, if hairs are an inch or 2 inches, which they might be in the first, 3, 4, 5 months, you're not really going to notice. You're not going to have thicker hair down here. So just to set expectations, things for hair growth take a long time to show up, even if they are working. So patience is really key. And I think, I'll have patients that come in, they're like, I've already used minoxidil, and, we talk and they used it for 3 months. And I'm like, that probably wasn't long enough to see if it was going to work for you. And so I think setting proper expectations with patients is really helpful, just to help them know when are they going to actually see a result. So minoxidil is available over the counter. It's available in 2% and 5%. Hands down, I always recommend 5%. It's going to be more potent. It is the men's version. The women get the 2%, which doesn't work nearly as well. It is a vasodilator that works to increase blood flow to the scalp, and it also prolongs the growth phase of hair follicles. So this is something we can use not only for hormone-related hair loss, but also for stress-induced hair loss, especially if the underlying issue, has been addressed. So if you had COVID, or if you had the flu, or, if you corrected a nutritional deficiency that was causing this can help with stimulating hair growth after that. There are tons of randomized control trials that look at this, product, especially the 5% version. It doesn't work in everyone. So I will say, even though I think it's a great product, some people, there's like a conversion that needs to happen in the scalp when this is used. And so it's not going to be super effective for everyone. And I'll talk about maybe how to make it more effective for some people as we go on. There is some initial shedding that can happen. We call it like the dread shed in the first 4 to 6 weeks. This is another place where people get really caught up with minoxidil. They're like, I used it and it made things worse. It caused my hair to fall out. But what it's doing is it's impacting it's speeding up the end of that resting phase of your hair follicle. So you're going to see more hairs fall out when that happens. But then it makes the growth phase longer. So again, ride the wave for 4 to 6 weeks. If you see increased shedding, try to use it for 6 months at least to be able to see. And maybe someone takes pictures. I mean, I think mine is easy because it's in the front of my scalp. I think it's harder if it's back here in the part line or in the crown of the head. Um, but if you can, I think track progress over months to see if you're noticing a difference. What can happen because you've had sort of this prolongation of the growth phase, when you stop it, you're going to go probably into a resting phase. So you might see it. It isn't that you're going to be worse off than if you never used it in the first place, but you do have to keep using it to see the results. And so this is the same thing that we talked about for those anti-aging products. This is about a maintenance approach. It's continuing a product, continuing this ingredient to be able to see the effect. But the reason that people are seeing that shed is because they've had this prolongation of the growth phase, and then they're moving into a resting phase, so they might see more hairs fall out.
Talk to us a little bit about proper use. Is this a once a day thing? Is it a twice a day thing? What regimen will help people have the best results?
If you're using the 5% just once a day, so that's part of the problem with the 2% is you really need to be applying it twice a day. And I'm not going to remember to apply something twice a day. And also, I think, applying it at night, I'll put it on at night, I'll rub it into my scalp and then let it dry. And, I might have to wet that area in the morning and kind of re-dry it or, brush it a few times, but it's not significantly affecting the texture of my hair a lot in the morning. So once a day at bedtime is usually what I recommend.
Some people mention using natural oils like pumpkin seed oil. How do those compare to minoxidil?
Pumpkin seed oil has some good data that it's almost as effective as minoxidil, but I don't wash my hair every day, and I think most people probably don't. And so applying an oil at night is just a no-go for me. I'm not going to apply it every night. So I think minoxidil can come in like a solution. It can come in a foam. And both of those things are, might, depending on your hair texture, might impact your hair or your scalp a little bit, but aren't going to have, you're not going to need to wash your hair and start all over the next morning. I have not ever bought pumpkin seed oil for my scalp, but I think there are formulations that you can find that are specifically for the scalp. Probably the same thing that you would find not for the scalp though. So I don't know that there's anything different about those, the pumpkin seed oil that's in the specifically for scalp products. They're usually combined with other ingredients to help stimulate hair growth as well. So that's probably what you're getting in the hair products that are seed oil.
Do shampoos with active ingredients really help hair growth?
I don't know how much that's really going to do. We're talking about scalp contact time. So shampoos can be helpful, but you need to leave them on for many minutes. At least two. Some people would say up to 10 minutes. And so you're doing a couple of drops. I don't know.
So we've talked about a lot of topicals. Another reason why people have hair loss is not just testosterone, dihydrate testosterone at the level of the scalp, but that combined with inflammation. And one really common form of, or one common way people have inflammation in their scalp is a fungal infection, right? So seborrheic dermatitis, that's a fungal infection. That's dandruff, okay? So talk to us a little bit about using ketoconazole or an antifungal. How could that possibly help with hair thinning?
Go listen to the first podcast on hair loss if you want some clarification, but I'm talking kind of about two different types of hair loss. There is stress-induced hair loss, which is related to, an illness or a stressor or a nutrient deficiency. And then there's this hormonal-driven hair loss. With that hormonally driven hair loss, we think that there's probably an inflammatory component at the level of the scalp. So this is really targeting inflammation. So it's an antifungal, but we're not really using it as much. We're not saying you have a fungal infection in the scalp and we're treating that. We're trying to lower inflammation. It also probably has some anti-androgenic, so anti-testosterone effect locally in the scalp. This is available 1%, 2%. I recommend the 2% shampoo used 2 to 3 times per week. Um, Part of what we get in this hormone-driven hair loss is our hair follicles get smaller and smaller and smaller and smaller and smaller, and then they disappear. So what we see is when this is used consistently, that hair density and diameter improves. That's why sometimes if you're getting thinning here, right around the temples, you'll get these like your hairs will just get really thin and really, really small. So this can be particularly helpful. You do have to use this, you have to leave it on for minutes, several minutes, at least 2, preferably a little bit more. So it's going to increase your time in the shower, but it can be really helpful as part of a regimen. And we're also often using this in combination with something else that we're using topically. So you may not see a dramatic difference using ketoconazole alone, but I think it's a great addition. If you have to, sometimes people will have seborrheic dermatitis, kind of this like, oily, sort of flaky scalp, kind of similar to Cradle's calf in a baby. Ketoconazole can be really helpful here because it's helping kind of thin out that layer.
So one of the things we're often considering when we're thinking about hair loss is blocking androgens or testosterone, dihydrotestosterone. And oftentimes, we, we want to keep our testosterone so we have good muscle strength, so we have muscle recovery, so we have healthy bones, so we have hopefully some sexual desire. And so sometimes we're in a little bit of a catch-22 because the testosterone at the level of our scalp is causing hair loss, but we don't want to dry up the testosterone in the rest of our bodies. So we're in a pickle, Kate. Help us out. We've got to kind of keep testosterone in some parts of our bodies and we want to get rid of it in other parts of our bodies. So how do we do this? Can you talk to us a little bit about topical testosterone blockers like finasteride and comparing the topical use of that to the oral use?
So finasteride is only available topically as a compounded product. There's not a commercially available option. And it is in the 5-alpha reductase inhibitor category. So it's reducing the conversion of testosterone into DHT, which is really this metabolite of testosterone. And that's really what's causing that shrinkage and then eventual disappearance of those hair follicles when we have hormonally driven hair loss. This is cool because it's about as effective as oral finasteride. And it doesn't have the same systemic suppression of DHT. So we get fewer sexual side effects. Sometimes people will have mood impacts from taking finasteride orally because of the impact on sex hormones. So we're not seeing those, fortunately, either. There was a study that showed a 68% reduction of hair loss with a pretty weak topical solution used once a day. So I think this is a really cool option, especially, using it in combination with something else, but even just by itself. I think this is a great option because it's pretty low risk in terms of systemic side effects. It's letting you get the benefit from the testosterone, but also kind of prophylactically maybe addressing that potential for hair loss. Obviously, I would want someone to still be monitoring and making sure they're not losing hair, but I think it's a great thing to use in combination.
Spironolactone is another one of those testosterone blockers. Can you again kind of compare the topical versus the oral use on that medicine?
About spironolactone now, which is in the same family as the finasteride. So this is also, available orally, and topically it's only available as a compound. And it also works blocking those androgen receptors. It can reduce that shrinkage of our hair follicles, so can be really effective as well. And you mentioned, you can use it also. That's another conversation about acne, but when you use and I don't actually know if there's data for finasteride For acne, I haven't used that in a compounded product, but for spironolactone, you can use it for topically for acne. Women with PCOS may be a good candidate for spironolactone, and again, it won't necessarily cause some of the systemic suppressions. Not everyone with PCOS has ragingly high testosterone levels that we want to reduce. Some will just have signs of high testosterone on the skin, but we check their androgens, we check their testosterone and DHEA, and they're really not that high. So I think this is where these topical products really shine when we want to keep some of the benefit of that hormone going on.
We use a lot of retin-A or trinitoin in skincare to have cell turnover regeneration. Is there any role for adding trinitoin to these topicals on our scalp?
There is, and I don't think everyone necessarily needs to use this, but if someone has been using minoxidil and they're not seeming to respond or just feeling like they're not, maybe they don't remember to use it every single night, there are a couple things that tretinoin addition to this regimen can do. Number one, it can increase minoxidil skin absorption, like almost triple the absorption that we get. And so it's taking that sort of, 5% potency of minoxidil and magnifying that. So better absorption. I also mentioned that about maybe 30% of people don't appear to respond to minoxidil topically. And that's because they have a low enzyme needed to convert minoxidil into the active form, which actually then acts at the hair follicle. Using tretinoin increase that activity of the enzyme that we need to convert minoxidil. So, my hope is that if we're helping people customize regimens for hair loss, if they're like, I did minoxidil for 6 months and I didn't, I got a little bit of hair growth, but not very much, we can maybe add in a DHT blocker like finasteride or spironolactone, but maybe we add a little bit of tretinoin too to get some better absorption and then that conversion of the enzyme that's actually going to make minoxidil work for them. So I think this is a great option. Now, as with our facial skin, we can get some irritation using tretinoin. And so I think I would want to assess someone's overall skin sensitivity, let them know that there may be some tolerability issues, maybe start with a much lower potency of tretinoin, which we can fortunately do in a compounded product. But I think this could be a really great addition to a hair loss compound or hair loss regimen. There was a smaller trial that used 5% minoxidil and 0.01% tretinoin, which is lower than the lowest commercially available potency. And using it once a day was as effective as using minoxidil 5% twice daily. So, and I will say, I know I said minoxidil, use it once daily. It's going to be effective. It will be more effective if you use it twice daily. But I think this is a cool way to get some increased absorption so that you do only have to use that product one time per day.
So we've got a lot of options for folks with hair loss, and it's kind of exciting to think about perhaps using some compounded options so we can layer or stack some of these options, particularly for people who want to use minoxidil or not use minoxidil. There are a lot of other things we can put in there to help. It's great that we've got more options than maybe we initially realized. Kate, do you have any final advice for listeners who might be feeling discouraged about hair thinning or hair loss?
I think the customization of what we can do with these, I say with the ingredients, we get to make it something that is tolerable, effective, and is something that someone can maintain for the long term to support their hair. Hair is, hair loss is one of the most distressing things that I hear people come in with. I mean, we have a lot of concerns that we address, but when you're looking at yourself in the mirror every day, when your hair has been something that has been maybe part of what defines who you are, what you look like your entire life, and all of a sudden it's thinning or it's, falling out in chunks, or you feel like your hairline is receding, that can feel really distressing for people. So I think what I would say in kind of conclusion is there are options. If you've tried one thing and it didn't work, or you took an oral and it had side effects that you couldn't tolerate, there are more options available. And I hope that feels really hopeful to people who are listening.
Kate, thanks so much for joining us today. This has been a helpful and hopeful discussion, and I hope people will come away a little less red in the face and feel like they have some tools to go to their health care provider and hopefully have a more fruitful conversation about rosacea and hair loss.
This was fun. Thank you.
Thanks for listening to Menopause Rescue. We hope you've enjoyed this podcast and it helps you create some time and space to make this the best half of your life. If you've enjoyed this content, please leave us a 5-star rating and review. This helps other listeners find this resource and rescue and restore their health. If you enjoyed this topic and want to learn more, check out our resource guide for this episode. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time. If you're looking for a menopause expert and live in North Carolina, take our free online class and see if we're a match for your needs. It's called Are We a Good Fit? And is a quick and easy way to learn more about our practice and what it has to offer. Hey, this is Dr. Watson. This is just a friendly reminder that this podcast is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed, and any information you get from this podcast is considered educational only. You should make medical decisions with your healthcare provider. The content of this podcast is not intended to be a substitute for professional medical advice. Listeners should not disregard or delay in obtaining medical advice for any medical condition, and they should seek assistance from their healthcare professionals.